I'm Barry Carr, I'm the Chief Executive Officer of the Continence Foundation of Australia. Could I please ask you to take your seats? And we'll get the morning underway. I'd like to formally welcome you all to the launch this morning of the 2013 World Continence Week, and thank you for braving this cold winter morning here in Melbourne.
A report by the Victorian Continence Research Centre in 2011 explored the awareness of people from different ethnic communities in relation to the prevention, treatment and management of incontinence. It found primarily that knowledge of the causes and treatment of incontinence is low across all core communities. Some of the key findings included a study of Chinese women found they were uncertain about the causes of incontinence and often self-blamed. Asian women commonly believe that incontinence is not an illness and not serious enough to seek medical help, and is often seen as wasting the doctor's time. In the Middle East, incontinence is viewed as a neurological or senile disorder among women. These findings, combined with a low number of calls to the National Continence Helpline from members of the core communities, gave rise to the call focus for the 2012-13 project, Incontinence Outreach in core communities. The term core refers to a wide range of cultural groups that make up the Australian population. For the purpose of this project, we have used the following description that acknowledges core is a combination of factors, and there is no one definition of core. There is identification with birth, ancestry, ethnic origin, religion, preferred language, or languages spoken at home. Therefore, the aim of the project was to develop and pilot a health promotion initiative targeting specific core communities in the education and awareness of incontinence, to improve the health literacy of incontinence and encourage help-seeking behaviours among core communities. The project was defined through a number of methods, including the research undertaken by the Victorian Continence Resource Centre. We consulted with continence nurses and managers, interpreting organisations, hospitals and organisations such as FECA and RDNS. We explored called initiatives undertaken by other organisations such as Beyond Blue, CODA and Alzheimer's Australia. Our findings shaped the direction of this initiative. We found that communication and language barriers were perceived to limit people's access to information and support services. There was a preference to receive more verbal and written information in their preferred language about incontinence. We found that bilingual information resources is recommended. These resources should include key messages to improve their awareness of incontinence. We found that basic strategies are needed for service providers on how to service called clients, for example, how to best work with interpreters. And we found that multiple communication formats are required for information dissemination. Therefore, we developed our outcomes to align with these findings. We developed translated continence information, which is now bilingual, information that is now available in multiple formats, audio, video and written, and it's easily accessible online. We have produced interpreting guidelines in a continence assessment for health professionals and interpreters. Bilingual information is now available on the CFA website via language-specific web pages, which has been developed for core communities and the health professionals working with them. The web pages are available in 20 languages, including Greek, Italian, Mandarin, and Vietnamese. On each language page, there are links to 17 new bilingual fact sheets on topics such as bedwetting, pregnancy, and continence products. There's a lot of information up there. These web pages also provide audio translations and videos detailing where people can get help. These new developments will allow for users to either view, listen, or read about the services that are available in the prevention, treatment, and management of incontinence. So we have a demonstration for you on how the language web pages work.
Okay, so there are 3 entry points to view the language pages from the Continence Foundation's homepage, and this includes the rotating language button at the top of the page, via the Other Languages tab and drop-down menu, and also via the rotating language button under the Featured section. By clicking on this button, you are taken to the language landing page, where you can select from 20 languages and also English.
廣東話
Hrvatski,
Somali,
I'll now show you the English page so you can see the information that's included on all translated pages. The page has an introduction paragraph outlining features of the page, an endorsement from a health professional or community leader, and a video encouraging users to seek help for their incontinence. On the left-hand side are the bilingual fact sheets, and these are sorted by category. On the right-hand side of the page, this service is available, and there's also a link for users to provide feedback about the website. We'll now take a look at the Cantonese page. So as you can see, straight away, all of the information is translated. There's an English hover function for each section of the page, which is useful for health professionals or carers who may be showing this page to a client or family member. There is also an audio option for each section on the page, and this can be accessed by pressing the play button.
排便節制資訊繁體中文。失禁係指不情願、不自主嘅大便或小便遺漏，排便節制問題亦
To view a fact sheet, you need to click on the title, which is also shown in English when you hover over, and this fact sheet will open in a new window, and you will note that these are now bilingual. The services listed on the right-hand side include the National Continence Helpline and information on how to access the helpline via the telephone interpreter service, a link to the National Public Toilet Map, and a link to information about financial assistance for continence products. Users can also provide their feedback to us in their own language. To finish the demonstration this morning, I'd just like to show you the video from our Italian page, and the person in the video might be familiar to some of you.
In Australia circa 5 milioni di persone soffrono di incontinenza. L'incontinenza è la perdita involontaria dell'urina e delle feci che si può manifestare con la perdita di minimi quantità o con la completa perdita del controllo vesicale o intestinale. L'incontinenza non è normale e può succedere a qualsiasi persona. Le cause più comuni dell'incontinenza sono gravidanza, menopausa, obesità, stitichezza, diabete e problemi della prostata. L'incontinenza può essere trattata, gestita e in molti casi curata. Se siete preoccupati, rivolgetevi al vostro medico di fiducia o chiamate il servizio di assistenza telefonica nazionale al numero 1833 0066. Per maggiori informazioni visitate il sito continence.org.au.
Thank you, Sam. So what are the next steps for this project? We'll be undertaking a pilot study from July to October this year to test the ease of access and use for the language-specific web pages. And we'll be testing these in 3 Victorian hospitals, the Royal Women's, the Mercy Hospital for Women and Box Hill Hospital. We're also producing 7 additional languages. As yet we haven't determined what these languages are, but we know there's a great need for them. And we're also developing a promotion strategy with an ethnic radio campaign in 20 languages commencing this Monday. We wish to acknowledge the involvement of the following people and organisations. We value their support greatly. We appreciate their input and the time they devoted for this project. So we are very excited about this project, and we hope you are too. So thank you for your time.